We have to change the policy direction of the Ministry of Health, where it is focused primarily on damage control, crisis PR, and marketing in general, instead of addressing the root causes of the issues facing the health.
Bless up my people. Welcome back to the channel. Welcome back to another video. And in this one, my people, you would have seen a little young girl, 11 years old, has gone viral due to a medical mission that failed by the Jamaican government, in which she can't be able to do her surgery to correct the scoliosis that she has in her back. And you can see the whole slantness in her back right there, some people. And so her mother took to social media to highlight. But my people, I'm going to hear the opposition spokesman on health, Alfred Dawes, speak on this issue and giving us some more clarity of what they have been hiding as it pertains to the whole healthcare system. And my people, we had seen where the Americas and other had issued an level 3 travel advisory to their residents back up in January, and same was resent again in July. And as Dawes is saying, all our Minister of Health, Tufton, is basically doing PR and deflection and all of that. Now we're seeing the doctor from America, Dr. Robert Brady, speaking on the very same matter, said that he has been coming to Jamaica for 20 years. There are some clear infrastructure issues that need to be solved. I made a request 2 months ago when we heard of the air conditioning issues. I said we need to fix it or make accommodation somewhere else. Can you imagine, my people? Poor people picnic being affected. Where this mother you gonna get so much million for pay for equipment to do surgery and all of that on her daughter? When the surgeons from overseas are willing to do it, brought their own equipment, and still this medical mission failed after they have spoken to the government 2 months prior. But listen to what Dawes is saying, my people. I'm going to explain in its entirety. And I want to go over some of the young YouTubers, them channel, and go and support them just the same. I want to watch the entire clipping of this on pressing events with Abby. So I'm going to go over our channel, my people, and watch the entire video with Dr. Dawes.
Until we reform the healthcare sector in Jamaica, we will continue to have different symptoms popping up in different hospitals, in different areas that are all related to the same thing. We have to change the policy direction of the Ministry of Health, where it is focused primarily on damage control, crisis PR, and marketing in general, instead of addressing the root causes of the issues facing the healthcare workers and users of the system. And that is why we have to have a change now. Otherwise, as I said, and you can probably understand a little bit more clearly now, things are only going to get worse if we continue like this. So before I take some questions, let me go through a little bit of the timeline of this, the events that have been taking place at the Bustamante Hospital. No, this is the first time that we're seeing this tour with all the cameras and a press conference speaking about the ills that are affecting the hospital. But these did not start today. As far back as August 26th, out of the 6 operating theaters, barely 2 were functional. And the hospital had gone into emergency mode, meaning that they were only doing emergency cases and a few short duration elective surgeries. Now this is a hospital that serves ear, nose and throat services, ENT, plastic surgery, orthopedics, ophthalmology, and of course neurosurgery. And when you have 6 operating theaters and only 2 are functional, and I should probably say 1.5, because only one theatre can really get to the cool temperatures. You know, a lot of patients, when they come into theatre, they ask the question, why is it so cold in here? The theatres have to be cool because just like how you put food in the fridge to stop it from being spoiled, when you have a lower temperature in an operating room or ICU, it prevents bacteria from flourishing. So it's a part of the infection control mechanism why the operating theatres have to be so cold. Now, when you have a theatre that is supposed to be 60-something degrees Fahrenheit, going up to 80 degrees, where surgeons are sweating while they are dealing with sterile cases that involve implants, metal that you're stitching up in somebody's body, that is a recipe for disaster. And some of these theatres, they get so hot and humid that you actually see the walls sweating, and there's water coming up from the floor. So it's a recipe for mildew, and we know the issues of fungal infections because of the $20 billion repairs taking place at Cornwall now that started with a fungus in the air conditioning units. So we knew, everybody knew, the letters were written, the procurement requests were sent to the Southeast Regional Health Authority that the operating theatres needed functioning air conditioning units. It did not come to the attention of the powers that be today. As far back as the 26th of August, the operating theatres of the Bustamante Hospital for Children were in emergency mode because only 2 out of the 6 were barely functional. At that time, the capacity to perform surgeries fell to only 20%, 1/5 of the regular weekly volume of surgeries. That is significant because every clinic, new children are coming on board and they need to have surgeries done. And if you're not doing as much, which was always the case, you're going to have a backlog. When you're only doing 20% of what you usually do, then the backlog is going to get worse. And this was known. Now, attempts were made to try and remedy the situation, and they just did not work. At one point, there was an idea to outsource the surgeries, have them done at KPH, but KPH had so many issues on their own dealing with the adults that to put the children there at an adult hospital, that would have just crashed that system completely. So a functioning hospital for children is needed, and you cannot just transfer these cases of surgery to the adult hospital, KPH. So that plan never worked out. Then another plan came to lease operating theatres at the Nuttall Hospital, but then the money was just not forthcoming, and that plan never worked. So the surgeons going to the clinics were met with angry parents, and because a lot of the staff, they could not do anything about it. All they had to do was just try to give a little bit of hope that something would be done. But this has been going on for some time. It was known that there were missions coming to Jamaica to provide surgeries that would not have ordinarily been done here. The importance of missions, medical missions to Jamaica, cannot be discounted. These are Jamaicans in the diaspora. They have gone abroad, they have excelled in their different areas of specialties. We're talking about nurses, doctors, therapists, and they organize trips every year to come back to Jamaica. And in this case, the scoliosis mission, they came to Jamaica with full teams and all of the equipment needed, the implants, to perform these spine surgeries. Now, it's poor people picnic who will feel this most. Because if you have money that can pay the over $1 million for the implants, you can get the surgeries done. But if you cannot come up with the over $1 million to get the surgeries done, these missions are the only way they provide the equipment and the implants to those who need it most. And that is why these missions were so important. It was known that these missions would have been here, and nothing was done to accommodate them.
So true does come out and expose Chris Tufton, my people, and I let we know, says not just this little girl alone that a medical mission has been put out for, but many others, pitney with all heart defects and you name it. He quoted that it's about 6 and more children that needs, surgery where them parents cannot afford. And medical missions are put on and they have to be postponed. So Tufton him run out now, my people, saying that he blaming the system of defects, not budgetary issues, as well as make we know my people. Right? And so me I wonder now if I not him a part of the system. Set in the system for sort out the healthcare system, so you talk about system defects. System defects, yes, of the AC. He even quoted there is no money issue in fixing AC here at the Bustamante. If I could wave a magic wand and AC is fixed tomorrow and it costs 20 million would be paid. Uno believe that my people, when they got 2 months notice and still not sort it out? My God. Or could I even sort out a different hospital for them just do them mission surgery? So them pitney life can be corrected and sort out and them parents them feel better. But every time some things like this happen, them come out with them whole heap of excuses and people life at stake. And so when Dawes say from last year, August 26, are we to take it that Chris Tufton knew about the operating theatres at the Bustamante Hospital for Children not operating in full capacity, in the sense where 6 of them are only barely 2 functional? Are we to take it that he knew from last year? A same situation with the whole dead babies them at the Victoria Jubilee Hospital, and all when the opposition leader Mark Golding asked him at what point did he know, him can't come out with a definitive answer. Some people are them are the people we don't want to lead, And him are the same one where it's alleged that wants to take over from Andrew Holness. It's got to be a joke, my people. With life at stake. With life at stake. Nobody to stand up and vote for the poorer class of people. What's gonna happen, my people? Wanna talk up in the comment section and tell me what you think, my people. Like and share out that one, yeah. Subscribe to the channel if you're new. Stay tuned for more videos. Stay tuned for more updates. Big up on yourself.